Hi, this is Dr. Tony Mork. Today I'd like to talk about what minimally invasive spine surgery is not. Not that long ago, I saw a patient in the office, and as I usually do, I will start to interview the patient to do a history anyway, and then a physical, before I start looking at the films and MRI scans, so I can develop a picture of exactly what I imagine their problem to be. This was a fairly young guy in his 40s, and he just had massive back pain, axial back pain. And I just looked at him and his age, and I thought, well, maybe facets, probably not, maybe discs, more likely, but just massive axial back pain, and extending for multiple segments. And I said, well, what's been done? And we talked about the conservative measures he had, physical therapy and all that. And then he finally said that he also had some minimally invasive spine surgery, and that the surgery has made his back worse. And I thought, okay, I said, where's the scar? And he showed, and he pointed, it was really right at the top of his, his butt crack. Pretty low for a surgical incision. I couldn't really imagine what had been done there. But I turned on the films and looked at the MRI scan, and lo and behold, this is what is described by this guy as minimally invasive spine surgery. Let's take a look. Well, as you can see in the picture here, is an axial lift by trans 1. A threaded kind of a rod that has been pushed up underneath the sacrum to actually bridge and supposedly fuse these segments. So S1, L5, and 4 is what it looks like to me. In addition, we see some facet screws here as well. On the AP, we can see the same devices. You can see the axial lift threaded device here bridging the really two vertebrae and the sacrum, and the facet screws as well. As you can see, this is an example of surgery that's not really, it may be looking minimally invasive, but putting hardware like that goes across multiple disc spaces is hardly minimally invasive. So sometimes the incisions don't really tell the entire story. In this case, I'm not even sure how you could get this equipment out if you wanted to, especially given the fact that this person's back pain was really no better or even worse since having this minimally invasive procedure. So the term minimally invasive, pretty loose. That's why I try to describe what I do as endoscopic in nature, using no hardware and no fusion. Hey, thanks a lot for listening. We'll talk to you soon.